Hello, I'm Dr. Tony Nesterenko, and I'd like to welcome you to our website. I'm assuming that you're visiting our site because you or one of your loved one has suffered from some sort of chronic condition. In our practice, we dedicate the majority of our time to chronic cases such as fibromyalgia, chronic fatigue syndrome, neuropathy, migraine and cluster headaches, vertigo and dizziness. Also, we deal with herniated and ruptured disc patients. We use spinal decompression with those patients. The techniques that we use in our office are brain-based therapy, upper cervical chiropractic, and metabolic testing. Now, the majority of things that we do with our patients that are chronically sick is brain-based therapy. Brain-based therapy was discovered by Dr. Frederick Carrick. He's a world-renowned neurologist, and he is the only neurological chiropractic fellow in the country. And what Dr. Carrick wanted to find out, he wanted to know why these patients were well one day and then they became sick, and what happened between that time. And what he found was these patients suffered from one of three things: emotional stress, chemical stress, or trauma. So emotional stress, we're not talking about 1 or 2 days of stress. We're talking about a long-term stress, like months or years of stress. And it could be death in the family, dealing with a sick family member, divorces, anything of that nature. Chemical stress, he found that people smoking, using drugs, taking a lot of over-the-counter medication can cause decreased firing of the brain. Also trauma, car wrecks, falls, any of those things can cause decreased firing of the brain. So what he found was that these patients that suffered from one of these three things, the upper brainstem began to overfire, which is the mesencephalon. And symptoms that you have with such a problem when the mesencephalon is overfiring is insomnia, anxiety. With our female patients, a lot of UTIs, the ones that have migraines, urinary tract infections, and this is caused by the upper brainstem overfiring. Stomach problems, irritable bowel, fibromyalgia, migraine, cluster headaches, vertigo and dizziness, just to name a few. It can absolutely ruin your health and your life. And doing the medical approach, you're going to constantly they're going to be chasing their tail. They never can figure out what's going on with these patients. They give you drug after drug, and with minimal results. So how did I get into brain-based therapy? I got into brain-based therapy because I suffered from a chronic condition. About 8 years ago, I began to have chronic insomnia. Started having chronic pain in both arms. I was getting 1 to 2 migraine headaches a week. I had horrible anxiety when I lie down at night to go to sleep. I couldn't lay still. I flopping around in bed and almost like a restless leg, but I was restless body syndrome. I tried pretty much everything to get better with this problem. I was trying general chiropractic, nutrition, trying sleeping pills just to get some sleep. Eventually, a few days, sleeping pills wouldn't even work anymore. I just felt horrible all the time. I was in a seminar down in downtown Little Rock. We have to get 24 continuing hours education a year to keep our license active. And I had a horrible night's sleep that night. I go into this seminar, and we have 4 different teachers that weekend teaching 6-hour segments. And this lady chiropractor comes in there, and I honestly can't tell you what she said that day. I was so tired and fatigued and felt terrible. But a lady chiropractor sitting beside me that was in the class said, "You want to be my partner?" And so I didn't even know what we were doing. She said, "We're going to do this pen test on each other, on the eyes." So she said, "I'll do it on you first." So I turned and faced her, which I was facing the hallway where this lady chiropractor was teaching this class. And she did this test on my eyes. And now I know what the test is called. It's called accommodation. And when she did the test on my eyes, this lady that was teaching the class looked straight at me. And she grabbed me by the hand. She said, "Come here." Put me at the front of the class. She said, "Everybody get up here and look at this." 78 chiropractors get up there, and she does this test on my eyes, and everybody's going, ooh, what's wrong with him? What's wrong with his eyes? And I honestly can't tell you what she said. My brain, I had this brain fog. I was just in bad shape. And I don't even remember what she said, but she did grab me by the arm and looked me straight in the face and said, you've been having a lot of problems. And I started to tell her what kind of problems. She said, I know, you don't have to tell me. She said, don't get adjusted, but only on the left side of your body. Don't let anybody adjust you on your right side of your body any longer. So she did give me her card and said, if you'd like to call me, you're welcome to call me. I'll discuss this with you a little bit more. So I started getting adjusted 4 to 5, 6 times a week on the left side of my body. And about that time, I received some information from this doctor who wrote this book right here, Dr. Michael Johnson, about how to get sick patients well that you're never able to get well with general chiropractic. So I started looking into this, and come to find out this lady chiropractor was a brain-based doctor. And what Dr. Johnson was teaching was brain-based therapy. And on myself, to back up about myself, about 3 or 4 weeks of doing this left-sided adjusting only, I started to relax again. I was able to start sleeping. My headache started decreasing. So I looked into this stuff that Dr. Johnson was teaching, and that's how I got into brain-based therapy. I went through all his courses and through his classes. And also Dr. Johnson, how he got into brain-based therapy, he suffered from migraines for 15 years. He went through Dr. Carrick's program, got accepted as one of Dr. Carrick's patients, and he has not had a migraine headache now for over 15 years. So what we found out was that upper brainstem's overfiring, the mesencephalon, the mesencephalic reticular activated system controls your sleep. It's cause of all the problems. When you have an upper brainstem that's overfiring, you're going to be sick. So if you are interested in getting control of your health and getting yourself back on track, I suggest you go to one of our sites on here on the website. We're going to have different links that you can, we'll talk about fibromyalgia, migraine cluster headaches, neuropathy, etc. And we'll get in a little more detail on these specific conditions. Thank you, and I look forward to hearing from you.